Thank you for including me in NIH's Office of AIDS Research commemoration of World AIDS Day. OAR and the many other institutes, centers, and offices at NIH are pivotal partners in research that brings us closer to ending the HIV epidemic. Of course, we know that research into new modalities for PrEP and treatment are key alongside research into an HIV vaccine and even a cure, but also implementation research being conducted with partners in communities to ensure that we understand the best way to deliver HIV and HIV related services to the populations most impacted. The theme of this 35th World AIDS Day is Remember and Commit. Today, it is important to pause to remember all those we have lost and to reflect on the tremendous progress we have made in the last 4 decades. We also must commit to continuing to do the hard work to make an impact, particularly for those disproportionately affected in the United States: Black and Latino, gay, bisexual, and other men who have sex with men, Black women, and transgender individuals. Today, the federal government has released the National HIV/AIDS Strategy Interim Action Report. This report details key activities undertaken by federal agencies, including NIH and the Office of AIDS Research, to accelerate efforts to meet the goals outlined in the strategy. The Interim Action Report highlights the 370 implementation research projects funded in fiscal year 2022, an increase of 21% in the number of funded projects. The report also details the NIH's launch of the HIV and Aging Signature Program to catalyze interdisciplinary research and training to meet the needs of people aging with HIV. In fiscal year 2022, NIH supported nearly 340 research projects in this program. I'm looking forward to continuing to work with OAR colleagues on key issues such as increasing access to PrEP for Black and Latino, gay men and women, and ensuring the effective responses for those aging with HIV and effective dissemination of research findings and best practices. We have made tremendous progress, but we know that we have more work ahead of us. CDC recently released data showing that in 2022, more than one third of the people in the United States who could benefit from PrEP have been prescribed it. However, the data show that disparities in PrEP use are still widening. Estimates suggest that 94% of white people who could benefit from PrEP have been prescribed it, but only 13% of those who are Black and only 24% of Hispanic and Latino people who could benefit from PrEP have been prescribed PrEP. NIH's implementation science research can help us address these gaps and find new ways to ensure Black and Latino individuals are aware of and can access PrEP. Thank you all for being here today to commemorate World AIDS Day with OAR, and we look forward to continuing our effort to help end the HIV epidemic.